When we started our journey at Lifecast into thinking about inclusive mannequins, we sought to represent fairly a 7-year-old little girl known as Gwen. Gwen lives with her family here in the UK and has Down syndrome. And we work closely with Gwen and her family and the Down Syndrome Association for Great Britain to produce a realistic copy of the Gwen mannequin using 3D scanning of Gwen's face and live casting of her hands and feet and copying of her scars to create a mannequin that would allow us to have better conversations with people about what Down syndrome is and the complexities associated with having Down syndrome. You can see on the mannequin that we put glasses onto a lot of our mannequins to represent the patient as they would normally be. And patients with Down syndrome have a flattened face, they have a smaller head, they have a shortened neck, and quite often they have a larger tongue and quite awkward dentition. And they suffer from something called sleep apnea due to having poor muscle tone. They stop breathing because their airways can collapse on them. They have upwardly slanting eyelids, and quite often they have smaller ears and sometimes differently shaped ears. And the great thing in being able to copy Gwen and turn her into a mannequin is we've got all of these physical features that we can teach people about why children with Down syndrome have difficult airways and require specialist management. We're going to look at Gwen's hand just briefly, and we're going to show you again the single palmar crease that we were able to capture as part of the life casting process associated with Gwen. You can see here there's the single palmar crease, or sometimes known as the simian crease, which again is very common in children with Down syndrome. They have shorter fingers and they have shorter hands. They have gapping of the toes and broader feet, and I'll talk a lot more about the problems associated with the gait and walking associated with children with Down syndrome. I think it's really important to try and explain the whole story of Gwen. Gwen's mum Cora asks us to try and explain to healthcare clinicians that a child with Down syndrome is very different than a child without Down syndrome. They have airway problems that unless you're training on a mannequin with Down syndrome, you're not going to be able to replicate appropriately. The smaller jaw, the relaxed nature of the airways. And so again, training on a standard mannequin isn't going to give you some of that stuff that we really need to be emphasizing. Children and adults with Down syndrome have heart defects. They quite often have congenital problems associated with their gastrointestinal tracts. They suffer with immune disorders more commonly, as well as a little bit of obesity and sometimes leukemia, dementia, and many other problems associated with having Down syndrome. Grinding of the teeth, ear infections, some bony issues, some hearing and vision loss. So we really want, when we're promoting the Gwen mannequin, to talk about all of these things, all of these slight differences that Gwen has that we don't have. Gwen's a joy to be around, but she's having a far harder health journey than the rest of us. I want to really spend a little bit of time now to think about areas such as Gwen's feet. And it may seem a really strange thing to be putting emphasis on to, but I want to try and just explain just simply that, by having broader feet with a deep plantar crease, Gwen struggles to get shoes to fit. Now, that may not be such a big deal, but when you combine that with the fact that she's also got a decreased range of movement in her ankles, and you can see, again, the puffiness of the ankles when we copied the Gwen. She also has external hip rotation, so her feet tend to point outwards. And again, this is very common in children with Down syndrome. They have poor foot clearance when they walk. They tend to walk on their toes, So again, not having a huge amount of heel contact because of the flat nature of the feet. That in turn leads to mobility issues. So, a child such as Gwen will struggle to get around, they'll struggle to walk. And there's so much associated with this particular mannequin that we can encourage people to really start to think about and really start to understand. Children with Down syndrome also have a problem at the top of their necks. And so, again, you should never head tilt or chin lift a child with Down syndrome, because if you do so, then you can actually cause them significant spinal damage. When we're building the mannequins, we're trying to tell the entire story. We're talking about a little girl who's having a harder life than most of us in terms of her medical history. She's a joy to be around. You'll notice that she's wearing glasses. You'll notice that she's wearing dance studio outfits. And again, that's quite important to us, that we want to show how inclusive we are, that Gwen has an interest in dance. She has an interest in looking nice. She wants to wear nice glasses. She wants to be taken seriously, just like everybody else does. Yes, she's got some health issues, but at the same time, we really want to stress how joyous she is and how much joy she brings to other people. I know many of you will be meeting the real Gwen at IMSH this year, and we can't really wait for you to meet her and the mannequin.